Hello, in this lecture we are going to learn more about the kidney and study its anatomy. When you hear kidney, you might think of a kidney bean, and indeed these organs are bean-shaped structures. They're about the size of a typical bar of soap, and they sit between T12 and L3, so they sit slightly below the navel. L2 is right around your belly button, so they're a little below the belt, so to speak. Notice that the right kidney sits a little lower than the left kidney because remember the liver takes up a little space there. And each kidney has a little depression called the hilum. And the hilum is where the renal artery, vein, and the ureters enter and exit the kidney. Above each kidney is a adrenal gland. You can also call it suprarenal gland. This was an endocrine organ. And the kidney and the adrenal gland are held together with a little bit of peritoneum. They sit behind it and some connective tissue. So if you were to look at the layers that surround the kidney, there's three. The outermost layer is the renal fascia, and it actually surrounds the kidney to the adrenal gland and other structures. The middle layer is a lot of fat tissue, and then the closest layer is called the capsule. So this thick layer of adipose tissue is really important. It provides support to the kidney. If you should have too little body fat, what can happen is the kidney can fall. It can drop. This is called ptosis. And if we look at our picture, notice that if the kidney were to drop, you could get a kink in the ureter, and then this could result in urine not able to leave the kidney, and then it would back up into the kidney, which could be a problem. The capsule is the innermost layer, and it surrounds each kidney. They each have their own capsule, and this is good because it would prevent or help prevent any renal infections from passing from one kidney to the other. In this diagram, you can see a cross section, and we can look at each kidney, and in purple, I'm trying to draw here the renal capsule. Notice that attaches directly to the kidney. You see the yellow fat, and then out here would be the fascia. That's the more superficial layer. If we were to cut a kidney and look at it, this is a coronal or frontal section, notice that we see this lighter area out here. It's pretty thin. This is the renal cortex. This area with these structures is called the renal medulla, and these structures are known as pyramids. Now, each pyramid is going to have a rounded area called a papilla, which means rounded or nipple-like projection, and that's going to face this area in here, which is known as the renal pelvis. The base of each pyramid is going to face the cortex. So think of the pyramids as they are kind of pyramid-shaped structures or triangular-shaped structures, and each has a base and a papilla. Now, each pyramid is going to form what's called a renal lobe, and there's usually about 7 to 8 lobes. So I'm going to circle these lobes here, or these pyramids, and I see that there's 1, 2, 3, 4, 5, 6, 7, 8 in this particular image. Now, the renal pyramids, the medulla, the renal medulla, which has the pyramids, and the cortex out here, these have all the nephrons. When we look at the kidney, the basic functional cell of the kidney is called the nephron. That's the cell that basically forms urine from your blood. The pelvis, the renal pelvis, is this kind of like funnel-shaped area. It does not contain any nephrons, so it doesn't have anything to do with forming urine, but what it does is it collects all the urine from the nephrons. And so there's structures called minor and major calyxes. Now, calyx is singular. A minor calyx, I'll put a little M here, is going to be drained by one pyramid. So each pyramid is going to drain into this little segment, which is the minor calyx. The major calyx is the area that's going to collect from more than one. So this is basically major calyxes. So a bunch of those minors are going to drain into what you see as the major. So if I could maybe clarify this, let's look at the ones up here. So we have a minor here, a minor, and a minor, and then this would be a major because it's collecting from more than one. And so all of this drains into the pelvis, and then the renal pelvis is what sends the urine out the ureter. When you see itis at the end of the word, you know it means infection, inflammation. So there's pyelitis and pyelonephritis. So pyelitis is an infection in the renal pelvis. And a lot of times it comes from an untreated UTI, urinary tract infection. Now, we can have upper and lower. Upper UTIs are going to be in the kidney or the ureter because they're higher up. Lower tend to be in the urinary bladder or the urethra. So you might have heard of cystitis, which is an infection of the urinary bladder, a bladder infection. Usually you want to treat these because the problem is if that infection works its way up into the renal pelvis, the concern is it can get actually into the kidney. And if we get into the kidney, then we're really affecting those nephrons and our ability to form urine. So pyelonephritis is what we call it when it gets into the kidney. And so you're probably going to have high fevers, a lot of pain and vomiting. There'll be diarrhea. You can also have blood and pus in the urine. And so pyelonephritis is most likely going to be treated with IV antibiotics if it's bacterial. Now, the kidneys have a rich blood supply. About a quarter of your cardiac output goes to your kidneys. It's 1,200 mLs per minute. So 1.2 liters per minute is going through your kidneys. That's a lot of blood. And so we need to look at the pathway of blood. It all enters through the renal artery. So we would have the aorta going to the thoracic aorta, the abdominal aorta, and then you would see your branch to your renal artery. Now, when the blood comes in the renal artery, it's going to branch. And it branches into these pieces that are called the segmental. Now, you can call them segmental or you can call it lobar. It doesn't matter to me. I learned it as lobar, and that's what I tend to call it. But notice as we come in, we're going to have our renal, and then I'll make that 1. And then these are all the lobars. I'm trying to put a little 2 on them. So they are passing through the renal pelvis. Now notice they come out and they come between the pyramids. Once we're going between the pyramids, we're in what's called the interlobar. So I'll put a little 3. And you will see that here that there's arteries and veins. So interlobar, right, between the lobes. And then we have the one that curves. See how it's kind of like an arc? This is the arcuate. So I'll put a number 4. The arcuate is going to curve right between the medulla and the cortex. So it's a good boundary so you can see which is which. And then we have what are called the interlobar. And so these are all the way out here. You can see these light lines going into the cortex. Now, there's a couple different names for these. So you can call the interlobular, or some books call them the cortical radiate arteries. Cortical radiate because they're radiating into the cortex. I always learned these as lobar, interlobar, and then arcuate and interlobular. And honestly, the way I remembered it was the words got longer as I got further away from the renal artery. So I have the renal artery, the lobar, the interlobar. You just memorize the arcuate is the arch, and then interlobular. Now we're going to go to this picture so we can see this a little better. And as we come out, again, this is from your book, you can see segmental or lobar, interlobar, excuse me. And then we have our arch, right? That's at our boundary between our medulla and our cortex. And then it's really hard to see the interlobular. So we go to this view, we see the interlobular. Now these yellow things are nephrons. So notice each interlobular has a vessel that comes off of it. And this vessel is going to the nephron. So it's called the afferent arteriole. And then it goes to a special, this is a capillary network. It's blood. It's inside the nephron called the glomerulus. So this blood vessel, this capillary bed, has an afferent arteriole bringing blood in, and then it has an efferent taking blood out. So that blood goes in the glomerulus, out, and then it goes around these swirly things called peritubular capillaries, because this yellow thing, this nephron, these things are called tubules. And then from here, it's going to go back. Now you see the blue, and we're coming back through the interlobular vein to the arcuate vein, right? We have our little curve here, and then if we follow that back out, there's my arcuate, we're going to come back through our interlobar, arcuate, and then interlobar, interlobular, arcuate is the curve, the number 3, remember, is going to be my interlobar. And then I'm coming back through the renal pelvis to the renal vein. And I don't know why they do this, but notice they don't say, there's no lobar vein. They just call this whole thing coming back interlobar until you get to the renal vein. I didn't name them, I just teach them. So for whatever reason, there's no lobar or segmental vein. If we look at a close-up here at this glomerulus that I was mentioning, notice you can kind of see it now, this little tuft, this little capillary bed. So that's the glomerulus, right, inside the nephron. And it's special. It's different from all other capillaries for a couple of reasons. Number one, it has an afferent and efferent arteriole. No other capillaries had that. If you remember, what capillaries did was we always had a little arteriole, and that was bringing blood to, we'll just say, the capillary network. We'll just draw it like this. And then you'll remember that the capillary network was drained by the venule. This is how most systemic capillaries are. Well, this is different because there's an afferent arteriole bringing it in and an efferent taking it out. So that's one difference. Another difference is it's fenestrated. Remember, fenestrated capillaries are more permeable. They actually have little pores in them, so it's a very permeable capillary. And it has a much higher pressure. And the reason why it has a higher pressure is because the diameter of the afferent arteriole is larger than the diameter of the efferent. And so what happens is blood comes in, more blood comes in, and it accumulates inside because it's a smaller diameter vessel draining it. So this increases the pressure. And so the pressure in the glomerulus is usually around 50 millimeters of mercury. You might remember when we looked at the capillary network, when we looked at the arterial end, we said it was somewhere around maybe 35 pushing out, remember, hydrostatic pressure, and then it fell once we got to the venule. So we have a much higher pressure here, which is very important. When we look at what's happening in the kidneys, you'll be talking about filtration. And you might remember that filtration was pressure driven. And if we look at the autonomic nervous system, that's what's innervating most of the kidney. And we do have our sympathetic and our parasympathetic divisions. This might look somewhat familiar too. When we look at our sympathetic, you'll see the green here because we're coming off between remember it's called thoracolumbar area. But notice that the sympathetic's job, basically, it relaxes the bladder, so it fills with urine and closes the sphincter. However, it releases epi and norepi at the kidney, so it's really important in controlling all the blood vessels. So the sympathetic will mainly control that vasoconstriction and vasodilation of the blood vessels you just looked at. Whereas the parasympathetic tends to go mainly to the bladder and contract the bladder and open that internal sphincter so that you can void your urine. So this is one of the models that we'll look at in the lab as we go over renal anatomy. And I just want to take a minute and go over some of these structures with you. So when you see the model, it's not quite as foreign. If we look at this, I'll just kind of go through the numbers here. So you have a number 1, and the number 1 is on this structure. And it could be on any of these, but number 1 is on your it's on a lobe, and it's on a renal pyramid. So, as far as a practical would go, usually I would ask you to identify the structure. So this would be a renal pyramid, would be the best answer for that. Now, if we look at the pyramid, just to review, remember that every pyramid has a base. So we'll do this one. That would be the base because it's facing the cortex. And then this round area would be the papilla. And you can see numerous papilla. And it looks like, I guess that's we'll do these numbers for blood vessels. So on this one, number 6 is pointing to a papilla. We do have the calyxes. Remember, there's a minor and major calyx. So I put a number 2 on one of the minors. There's a bunch of them. You just find the papilla. and that would be the minor, and then 3's on a major because a major collects from more than one. 4, by the way, is supposed to be representing the renal capsule. It would be the membrane you would find here. And number 5 is a ureter. So this is a right kidney. You can see the right ureter. Now, as we come in, this is generally, this whole area would be the renal medulla. So again, I would either say identify the specific structure for pyramid or identify the area. You would tell me the renal medulla. This whole light area is the renal cortex. And this whole area out here is going to be, let me try that again. This is the renal medulla and this is the cortex out here. So it looks like, I'm guessing I wrote a number 15 to represent the whole renal cortex. If we look at the blood flow coming in, we have our renal artery and renal vein. And then as we come through the renal pelvis, this number 9, this is your lobar or segmental artery. As we come out between the pyramids, now I have my interlobar, so that would be 11, it looks like. Then I have my arcuate, number 10. The red one's the arcuate artery, the blue one's the arcuate vein, and then these are my interlobular out here. So trying to make sense of what I may have written and forgot, this number 14, I would guess I'm pointing to the arcuate artery. And again, on a practical, I would say name the vessel. And this number 13 is definitely pointing to an artery. So this would be my interlobular artery. So hopefully that helps prepare you so when you look at the kidney in lab, you'll be able to find these structures. So this is the end of our lecture on kidney anatomy.